Hey everybody, Dr. Rob here, Facebook Live, Proven Health Alternatives. It is Friday and I am excited to share some leading edge material today. We missed yesterday, sorry, just swamped with webinars, patients, things like that. But today, I can tell you more than makes up for it. We've got a lot of good, intriguing information. I unveiled it yesterday amongst all my colleagues on webinars. And this information, they were DMing me, they were calling me, they were texting me. You guys are going to love this. I hope all is well. We've got Memorial Day weekend on the horizon right here. So I hope everybody's able to go outside, go out safely, enjoy themselves, eat something of health and fun, and just continue. We just got to keep going. It looks like some things are turning around, and I'm always very hopeful. And I appreciate all your support. I appreciate all your messages. I appreciate if everybody could like, comment, ask a question, and share the material. Because this material you want all your friends and all your colleagues, your patients, your doctors, whoever, to know about it. This is a study that came out 3 days ago. It's on obesity and COVID-19, the role of visceral adipose tissue. So when we talk about fat or adipose, fat is adipose tissue. There's a few types of fat that I want to define. Number one, I want to talk about visceral. Number two, I want to talk about subcutaneous. Subcutaneous is what it says. It is on the surface. I like to call subcutaneous the pinch an inch. When you pinch an inch, you grab it. Visceral is over the viscera, which is all your organs inside. Now, what's most interesting about that fat is not only is it so close to the organs, that fat, as we all know, we've always been able to define as a highly inflammatory fat. Nothing's going to resonate more when I go through some of the numbers and some of the stats in reference to a positive COVID-19 test. And these all were PCR tests. So once again, the viscera, over your visceral organs, that fat can infiltrate your organs, highly inflammatory. Your subcutaneous. Subcutaneous is that pinch an inch. So the information was there was 30 patients that were COVID-19 positive. They had an increase in their visceral fat area by 1 square decimeter. 1 square decimeter. It's minuscule. It literally, we wouldn't even be able to notice it. Now understand that it is over your organs, was associated with 22.53 fold increase for the risk of going to the ICU. That is a prodigious jump. 22.53 fold increase for the risk of ICU. In addition to that, it was a 16.11 an increase in need for mechanical ventilation. So if you have a larger amount or a little bit more visceral fat and you're COVID-19, your chances for going to the ICU are huge. And not only are they huge, they're also huge that you need to go on a mechanical ventilator. So we all know obesity is one of the most common comorbidities. As a matter of fact, it's the most common morbidity for anybody 65 and under that needs to go into the hospital. And the biggest thing that we talk about in reference to the COVID-19 is getting a really bad response or having to go to the hospital. We don't want anybody to get sick, and we don't want anyone to have to go to the hospital and ICU and mechanical ventilation. Interesting in that with this obesity, we can really define it now as a higher level of visceral fat. So they measured the upper abdominal circumference. Each additional centimeter, which is less than a half an inch, increased 1.1 fold increased risk for ICU and 1.25 increased fold for mechanical ventilation. Not so much. You would have thought more from your upper abdominal fat. Now, here's the takeaway. Tremendous visceral fat, not so much abdominal fat or upper abdominal. No increased risks with the increase of subcutaneous fat or BMI. BMI is height over weight. Subcutaneous is the pinch an inch. So if you're heavy, it's never good. And if you're heavy with subcutaneous, it probably isn't good. But when it comes to a positive COVID-19, it's your visceral fat. So everybody's like, okay, well, what do I do? How do I measure it? Where do I go to? It's very interesting. For me, I have something called an in-body in my office. And my in-body not only gives the body fat, truncal fat, extremity fat, arms and legs, it also tells me your visceral fat. And as your visceral fat increases, serious health conditions. So anybody who has an in-body, or any doc you know has an in-body, that's your choice. If anybody's interested, again, we can put a link. I was just speaking to a good friend of mine this week, Dane Donahue of 8 Weeks to Wellness. He's instilled that in his 8 Weeks to Wellness, and that's a great job. I have it in my office. It's a standard bearer when you walk in my office that I do an in-body. I want to know your body fat. I want to know the distribution of your fat, and I want to know your visceral fat. That visceral fat, one more time, will predicate whether you have a bad clinical outcome in health or a good clinical outcome. You were pointing at me? Was there somebody?
No, I say visceral fat is better around the organs.
Right. Okay. Okay, great. So again, I'm on my phone, so I don't have my laptop, so I can't see the questions. So critical takeaway, not just your body fat. Once again, your visceral fat. Everybody, when you get back into a doctor's office, ask for that in-body test.
What's the number for visceral fat? Like, what should you be under?
Great question. So the question was, what number is visceral fat? So in the in-body, you want to if you hit 10, it goes up to 20. If you hit 10, you're a cardiovascular disease risk. Now, for me, I want to see everybody walking in my office 5 or less. What I will tell you, from doing hundreds of in-bodies over the last 7-8 years, the younger you are, it seems the less your visceral fat, which is kind of understandable. But having stated that, you want to be 5 or less. And what I've noticed about visceral fat versus subcutaneous fat is the subcutaneous fat, 80% is if you increase exercise and you run around the block, if you will. 20% is changing your diet. So diet still plays a role. Your visceral fat is the true converse in that it's 80% diet and 20% exercise. So people exercise hard, they will make an impact on their visceral fat. It's getting that diet tight. It's getting the sugar out of your diet. It's getting those carbohydrates out of your diet. Getting those crappy carbs, getting those crappy sugars will help you not put down that visceral fat. So great question. So I like under 5, under 10 CVD. I have patients that come in 20. I mean, they're big, they're corpulent. And I explain to them, you've got a long way to go. How long does it take? Well, I can tell you this, losing a few inches in your waist is pretty quick. You can do it if you need. Losing the visceral fat isn't as quick. If you lose 1 point in visceral fat, so remember I said 20, under 10, it could take a year for you to get to a good starting point for visceral fat. However, your option isn't as good if you don't do it.
1 point a month?
1 point a month is good. I've seen some people drop 2, but if you could do 1 a month, you're going to turn it around. Now, of course, you don't want to walk in with a 20 on my in-body, but some people do. Some people are quite heavy. And it keeps coming back. It keeps coming back to the idea, the resounding idea that the problems with our health and the problems with COVID-19 are lifestyle oriented. There's many people who don't believe it's real, that kind of stuff. I know that the virus is there, but they don't believe it's real because it hasn't hit them, or they're fortunate enough to be very healthy and they don't have those comorbidities. So whatever you do, now's the time to get healthy. Are we good? Fabulous. Got another great study. Now, everybody knows I work for Arconia Laser and I use their lasers. I always prefer lasers with a red and a violet light. The red light is of 635. The violet light is 405. This is visible light. So they expel or they express photons. Photons are units of energy. So they're actually, if you will, almost literally injecting. It's being absorbed, but in a for analogy, it's actually injecting energy into the body, cascading cellular metabolism, ATP, oxygenation, and neurotransmission. The best phrase I've ever heard is electromagnetic transfer. It's energy going into the body. Energy going into the body to stimulate the mitochondria, once again, ATP, and to allow healing to speed up. The right amount of energy allows the body to work in sync, and it's a beautifully functioning system. The red light is interesting, and there's a lot of good musculoskeletal outcomes. And FDA clearances with it. The violet light is more antimicrobial, antiviral, antibacterial. The combination is outstanding because it has a balancing effect on the body via what we call the autonomic nervous system. The violet light now has really come to the forefront because there's more energy in the violet light than in the red light. So if you took a normal 800 to 810 nanometer wavelength, it would be a heating laser. I don't like heating lasers. I'm all about photochemistry. I'm all about non-thermal laser approaches. So if you were to take the 635 that I use on myself, on all my patients and my family, the difference in energy from that hot laser, if you will, to the 635 is a 27% increase per photon per second. It's substantial. Then if you take the next step from that 635 to the violet light, it's another 57% increase. So if you look at the 810 to the 405, 405 has double the amount of energy going into the body. Smooth, not getting pushed because it has the lower the wavelength, 405, the higher the energy. The higher the wavelength, the closer it has to get to the body, the more power it has to push in. So if you were to take an injection and you would slam it in, your body would tense up. It would defend against it. If you were to take it softly and smoothly and just put it in with the finesse like a 405, it would go through all the tissue and pierce deeply, be absorbed, and then penetrate throughout the body. So it's fascinating what the combination of these lights can do. Let's get to the study. This was in, here we go, Journal of Photochemistry and Photobiology, May 1st, 2020. It was published ahead of print. So light as a potential treatment for pandemic coronavirus infections. Wow. So number one conclusion, the violet blue light, 400 to 470, I use the 405, is antimicrobial agent against numerous bacteria, fungus, virus, and the like. In addition, it's shown the visible violet light inactivates several viruses, including the common flu coronavirus. So the violet light, before I answer the question, 405 Arconia, which I use, come to my office if you're interested, find Arconia practitioners. Not only is antimicrobial, antibacterial, it's also shown the violet light to get rid of or inactivate, remember viruses aren't live, the common flu coronavirus.
Dave wants to know how many treatments are needed to see positive results. D'Angelo.
Hey Dave, how are you? Purity Coffee, how are you? So for me with the Arconia laser, I believe about 6 to 8 visits, you're going to get the kind of outcome that you're looking for. You're going to get an elite clinical outcome. I always tell everybody when I treat people, I take a baseline. So I always assess. And then I treat people and then I reassess. What we're seeing is a speedy recovery. Now, interesting. So everybody knows. Now, we have a handheld with the violet and the red light, which is called the EVRL, Arconia Violet Red Laser. In addition to that, they just released yesterday, we did the grand opening, if you will, or grand revealing of it. We now have an FX405, so I can send a picture if anybody's interested. I have the prototype in my office. I'm actually doing the studies on it. In addition, let's get back to this study, light as a potential treatment for pandemic coronavirus infections. We talked about the violet blue, the red light, 635 nanometer, visible light, what I call the sweet spot. So red light reduces respiratory disorders similar to those with coronavirus infection. I mean, look what this study's saying. Well, Arconia didn't do this. This was just a study that we found. In addition, the red light was shown to alleviate chronic obstructive lung disease and bronchial asthma. So look what it's saying. It's helping ameliorate this study with the combination of the violet and the red, bacteria, virus, and things in the respiratory area. What a great choice. When I saw this, I was very robust in sharing this information with you because now, in addition to changing the lifestyle, exercising, and giving our nutritional protocols that we share all the time, now we know laser therapy is added into the armamentarium and that protocol for you. So the patients that are coming in are receiving all that, and I strongly recommend everybody take a look at the literature, see where it's pointing, and seeing right now, without a vaccine, without a drug that we know works, our only choice is what we deem alternative, and alternative is alternative to what? Medicine or natural or medicine. We need natural medicine, supplements, laser, exercise, and good diet. And one more that we have, a third study that I wanted to share with you before we open up to any questions. Again, feel free to ask questions, make a comment, share it. Again, we get a lot of DMs, direct messages and comments afterwards, because I'm getting the feeling that a lot of people are going back to work and they're not able to tune in like they were when we were everybody was in quarantine or isolation, if you will. Diabetes, COVID-19, and the hospital mortality rates. Type 1 and type 2 diabetes are associated with an increased risk of COVID-19 hospital death. 1/3 of coronavirus deaths in hospitals were from diabetes, and those hospitals were in England. 1/3. So the first thing I'm going to tell you is drop your blood sugar. Stop eating the crappy carbohydrates. Control what you eat. That doesn't mean everybody has to go on a keto diet. And actually, we can talk a little bit about that. But I just want to give you some more information. The data was gathered over a 2.5-month period from March 1st to May 11th. Type 1 diabetes had a 3.5 times increased odds of dying. That kind of makes sense. That's insulin dependent. And type 2 diabetes is 2.03 times increased odds of dying. So blood sugar is a problem. The source was the UK National Health Service website. I alluded to the keto diet and done a lot of lectures on the keto diet, like the keto diet. I'm a big believer in diets as a lifestyle. Specific, I don't want to say fad diets or diets that are specific for condition, I call conditionally necessary. So with the keto, I don't know if I necessarily would do the keto for 5 years running. I certainly would do it for a time period. I would certainly do it for weight loss. I would definitely consider it for neurodegenerative disease. And I would do it if someone did not know how to watch the carbohydrate consumption and could need it to be taught. In addition, for people who have SIBO, I'm not a huge proponent of the FODMAP because of lack of compliance. There's some good FODMAP diets. Best SIBO guy I know out there is a good friend of mine, Dr. Warren Marks. We're going to get him on next week. We're going to talk a whole bunch of different things. We'll talk about gut health, things of that nature. In addition, so I call it the Keto Map. It's a combination of the keto and the FODMAP that I put together that is going to be coming out in my upcoming book. So do we have any questions? Nope. It's been a quiet Friday. So I hope you guys find the value in everything that we're trying to share. We're going to try and be on again every day, even Memorial Day, Monday to Friday at 1 o'clock. Guys, this is our time. This is our time to stay healthy. What we're finding out, the information is really stout to the idea of decreasing carbohydrates, taking better care of yourself, adding laser, get rid of your visceral fat, get exercising, watch your diet, exercise. If you have any questions, feel free to reach out to me, like it, comment, share it. Look at me on Instagram if you like. It's Dr. Robert Silverman. We're still doing the antibody test. There are people calling. It's right there for you. And I'm always here for you. Have a great weekend. Dr. Rob, always yours in health.